So what if the answer to one of America's biggest challenges wasn't another big government program coming from the top down? What if it was a movement led by citizens themselves? Today, we're going to dig into a pretty bold blueprint that aims to do exactly that for the health of our country.
Let's just start with a number that should really make you pause. 40.7%. That's how many kids in America, we're talking 30 million children, have at least one health condition. Now, that's not just a statistic, right? It's the starting line for a crisis that a new movement is trying to solve, literally from the ground up.
All right, so before we can really get into the solution that's being proposed here, we have to get our heads around the massive scale of the problem. This is the why. This is what's driving this urgent call for a completely new way of doing things.
And look, this crisis goes way beyond just children. U.S. life expectancy is trailing other developed nations by almost 4 years. A full 60% of adults are living with at least one chronic disease. Autism now affects 1 in 36 children. I mean, that's an incredible increase from the 1980s. The problem is so deep it's even affecting national security. Get this, 77% of young adults are ineligible to join the military because of their health.
This visual right here shows you where it all begins. It's like a fork in the road. A child's health path is often decided in their first few years. Negative stuff can push them onto an at-risk path, while the right support can guide them toward flourishing. The huge insight here is that those earliest years can literally define a whole lifetime of health.
So when you're facing a crisis this big, the People's Commission argues that just, patching up the problems isn't going to cut it. They believe we need to completely shift our thinking, and that all starts by asking a totally different question.
And here it is. For decades, our entire healthcare system has been built around one single question. What makes people sick? The People's Commission just flips that completely on its head. Instead, they ask, what keeps people healthy and helps them thrive? Now, this isn't just playing with words. It is a revolutionary change in perspective that changes absolutely everything that follows. This whole new way of thinking actually has a name: salutogenesis. Put simply, it's the science of creating health. So instead of waiting around for a disease to show up and then trying to fight it, salutogenesis is all about building the biological, social, and psychological foundations that help people flourish from day one. Okay, so if that's the big idea, the philosophy, how do you actually make it happen? How does it translate into action? Well, the Commission lays out a 3-part strategy to make this idea of flourishing a reality. The first part of the plan is this intense focus on the first 1,000 days of life. That's from conception all the way to a child's second birthday. Science tells us this is the absolute critical window. It's when brain architecture gets built, when the immune system develops, when emotional foundations are laid. And the numbers are just staggering. Every dollar invested here gives you a return of between $7 and $13 over a lifetime. It is the ultimate form of preventative medicine. Pillar number 2 is all about who leads this change. And this is not designed to be another government program handed down from on high. No, the entire model is built to be a bottom-up, citizen-powered movement. The whole idea is to empower parents, teachers, and local leaders to be the ones driving the solutions themselves.
So how does that actually work? Well, the Commission proposes some really clear, actionable steps. Citizens can get access to a citizen toolbox with research and tools. They can jump into virtual town halls to help shape the strategy, connect with initiatives that are already happening in their area, and use evidence to push back against misinformation.
Now, this third pillar is maybe the most innovative part of the whole plan. It involves using the power of artificial intelligence. But here is the critical twist. The goal isn't for AI to replace human connection. The goal is to use it to amplify that connection and make a ridiculously complicated system radically simpler to deal with.
This contrast really says it all. I mean, look at this. On the left, that tangled, confusing mess, that's the reality for so many families trying to navigate the current system. It's overwhelming. On the right, that's the vision. A simple AI interface, this whole-person salutogenic assistant designed to just cut through all that complexity and give clear, personalized guidance.
So how would an AI like this work? Well, at its core, the assistant pulls in data from every part of a person's life. We're talking biological, social, environmental, even political factors. By connecting all these dots, from your genetics to your zip code, the idea is to go way beyond single data points and create a truly complete, actionable picture of someone's health.
So when you boil it all down, the source material here is really presenting us with a fundamental choice. A choice between two very different visions for the future of health in America.
On one side, you have the approach of a proposed Make America Healthy Again, or MAHA Commission, which is described as a more traditional, top-down model that's focused on treating disease. And on the other side, you have the People's Commission, with its bottom-up, citizen-led model that's focused on creating health. This slide really lays out that contrast. A government-led effort to treat sickness versus a citizen-led movement to build well-being from the very start.
The choice between these two ways of thinking really comes to a head with this powerful call to action. The People's Commission leaves us with this provocative thought. What if the most effective way to heal a nation really does begin with its citizens, one child at a time? What do we owe the next generation?